Welcome back. It's Dr. Jen Ferboni and Dr. Dom here, my husband, also a fellow physical therapist. And we are going to be showing you 3 pregnancy prep routines or movements that we did all before last birth and we're doing now before this birth. These can be started anywhere between 34, 36 weeks. Or of course, you can talk to your healthcare provider and see what they recommend. A lot of these moves are from what we've learned from spinning babies. So this is a resource I'd highly, highly recommend. It's really just about preparing your body better by creating space to help baby get into an optimal position. So this first one here is called a Sidelying Hip Release. So we do this on the edge of the couch. You can do it on any surface that's really kind of elevated. The goal here is that I'm going to be laying on my side, and he's going to help to make sure that my pelvis is stacked right on top of each other. So my hip isn't moving forward. It's not moving back. It's kind of right on top of each other. He's going to apply a little bit of pressure, make sure it's not too much, you're not too uncomfortable. And as he applies pressure, I'm going to allow my leg to come over and hang off. And I take just about 3 to 5 breaths here. We do it 3 times on each side. So we'll show you just once on each side. So I'm going to come down, lay on my side, and he's going to make sure I am stacked and put some pressure down. And then I'm going to lift and allow my leg to drop heavy. So from here, I can take 3 to 5 big, deep, relaxing breaths, really allowing my leg to just dangle here. And I'm trying to open up the back side of my pelvis, relax in my piriformis is what they recommend on spinning babies. And then I can come back and up. And when he helps me to the other side, we're just going to lock arms. He's going to allow my legs to come down and he helps me up. Okay. So, and then to the other side. And if you need help coming down on that other side, that's where you can use their support, your partner's support as well. So again, he's going to put some pressure down onto my pelvis, keep it completely stacked, lifting my leg, allowing it to hang off and hang heavy. And I take just 3 to 5 nice, slow, deep breaths here. Okay. So this is again, a way to help to open up space to create room so baby can get into most optimal position ideally. Now, again, you can learn more about the specific technique and all the mechanics that really go into it on spinning babies. I'd highly recommend. And again, grab arms and put pressure to help me come back up. Then we're going to show you just a couple more movements. So for this one, we use a long scarf that I had lying around. I think we have folded it in half, but it's going to essentially wrap from the bottom of my belly to the top of my belly. Now, this is an ancient tradition called rebozo technique. And what we call it is just kind of like belly sifting. You can learn more about the rebozo by going and learning specifically more about rebozo, but belly sifting is also something that spinning babies goes through. And so we're going to show you how we set it up. So he kind of puts it around me and then I come down and I just kind of help to make sure it's at the base of my belly and toward the top of my belly. And he's going to kind of get all the edges so that I feel supported all the way around my belly area. Yep. And I just want to be really relaxed here. So he's going to put just slight upward pressure to kind of lift that belly. It's not a ton. Okay. So it's not a ton. You're just doing a little bit. And then from there, he's just going to allow his arms to kind of rock or sway, kind of move, kind of go back and forth. And it's kind of just to what feels best for you. Now, me as mom here, I'm just trying to really breathe into my belly, relax, and just allow the movement to allow some relaxation of that belly. Okay. You can open your legs a little bit more if that feels better for you, but just trying to breathe and relax. And for the partner, you're trying not to just bend from the elbows too much so that you're not getting tired in like the biceps, but you're just kind of moving from that whole upper body to help feel a little bit more supported. Okay, and you can go just side to side. Sometimes he goes a little bit faster and that feels good. It just helps to that gentle sifting movement. Not trying to shake any babies, but just sifting nice and slowly helps to relax tension along that belly as well. So again, deep breaths in. We do this for probably 2 to 3 minutes. It's really up to me how I'm feeling and how long I want him to keep going. And then he will go nice and slow on the way down, allowing the tension to gradually allow the weight of my belly to come down. So it's not just like a sudden from an elevation to a drop. And then what we've also been working on with this is some booty sifting. So to help relax some tension in the back of the pelvis, he's going to wrap kind of around my pelvic region, hold down really tight, and then go side to side pretty quickly. And here I'm again just trying to breathe, relax, allow the heat to create and help to ease the tension and cause the more relaxation. Okay. And I just relax and breathe. This is all about relaxation, all about opening, all about helping baby to find their way into a more optimal position. Okay. And we don't do it for too long so that he doesn't get too tired with his arms for that one. We probably just do it for about a minute. Maybe. And then I do one more by myself, but you can always have a partner. So he can be here just to show how you can kind of assist. So I'm going to actually come from the back of the couch here. And I'm going to go forward into an inversion. Now, I am used to being upside down, being a previous gymnast, so it's easy for me. With someone who's not used to it, this way having support and ensuring that someone is there can be really helpful. So what I'm going to do, I'm going to start by kneeling up onto the couch, and he can help to guide my shoulders down. As I come down, I'm going to drop onto my elbows. And now from here, tucking my head and having a slight tuck of my pelvis, I'm going to try to relax in my belly and my hip. And I'm going to do 3 big, slow breaths. And again, if you need help with like your shoulders, so your partner can kind of support into your shoulders a little bit more, kind of help to hold you so that you feel a little bit more stable if you're not used to being in this forward position. Then as I come up, he can use my shoulders to help guide me back. And I'm probably a little flush from that, but that really helps to relax some ligament tension along those round ligaments here. But again, you can learn so much more from a website like Spinning Babies. They have different courses and classes. They have partner courses, which is where we learned all of these. And they go into a lot more detail on the science and the reasoning behind it. So these are just 3 that have helped to support my body and feeling good and ready for birth. And I hope that they help to support you as well.
Don't forget, if you love what you're learning, I have so much more in stock for you. So hit that subscribe button, check out the other videos I've done in the past, and leave any comments of any suggestions that you have for videos in the future. And I can't wait to help you feel incredible and amazing within your body.